Okay, so the next system that we are going to look at is the skeletal system.
So it's a vegetable plant. Okay.
And with the skeletal system, we know that the tissue of the skeletal system is a connective tissue, right? Do you remember connective tissue? So the organ of the skeletal system is what? Bones, and the tissues of the bones, we have two types, what we call spongy and compact bone tissues. And then the cells, we have the osteoprogenitor cells, which are more like the stem cells. Which form the osteoblast cells, which are the active form of the bone cells. And then they mature to form what we call the osteocyte, which are the matured state, the matured cells. So the total number of bones that we have in the body, we have 206 of them. And we've divided the bones into the two sets of skeletal representations, which we refer to as axial skeleton and appendicular skeleton. So the axial skeleton includes the axial part of the body, which is the skull, the vertebral bones, the ribs, and the sternum. Part the appendicular skeleton includes your girdles, and your girdles are your shoulder and hip girdles, which they call pectoral for shoulder girdle, and pelvic for the hip girdle. And then your limbs.
What is the one after girdles?
Limb. Your limbs.
Girdles. Pectoral.
And your limbs, you have the upper limbs and then the lower limbs. So we are going to see these axial skeleton, appendicular skeleton. We are going to look at some bones with their shapes. We'll look at their shapes, and you look at just the features on bones. So first, the shape part. Some bones are flat Some bones are long, some bones are irregular. So we have all kinds of um, different shapes that we can see of bones. So that's like example of their different shapes that we can see. And then in terms of the features on bones, for instance, when you take a long bone, it's divided into sections. The very end of the bone is called epiphysis. Yeah. And then the shaft of the bone, which is the middle part of the bone, is called diaphysis. And then there is the area between the epiphysis and the diaphysis called metaphysis. Also, apart from the features in terms of the parts of bone, we also have the markings on bone's surface. So some of these markings include things like, it can include anything like tuberosity, which we see on this like the humerus, for example. Tuberosity is a small, rough projection on the bone. When it's large, rough projection, they call it truncata. And you can see that on, you can see that like the femur. Some bones, again, like the humerus and the femur, have a portion called head. It's roundish. The femur has a place called neck. A hip bone has the edge area of the hip bone has a crest area, okay, which is like a line of protrusion. Some of the markings include indentations or depressions where blood vessels travel through and stuff like that. So sometimes they call it sulci. And then some of the surfaces on bones are more like shallow depressions. And shallow depressions, they call it something like fossa. So they have all these names. And you know, certain bones, like the bones of your skull, have spaces, like air space, and they call that sinus. Okay, you all know your sinus, right? Like, say sinuses. And then if it's a bone with a small hole in it, they'll call it foramen. Okay, they'll call the small hole in a bone foramen. If the hole in the bone is big, then they'll call it canal. A large hole in a bone is called canal, or sometimes they use the word meatus. Same thing. So these are different terminologies they use on bone surfaces, depending on how it's looking at. And so the simple thing about it is that when you look at a bone, there are areas that are protruded, there are areas that are in a groove depression where they give specific names depending on how they look like. And these surfaces are usually, like the protruded surfaces, are usually areas where the tendons of muscles attached to, or ligaments attached to. Ligaments are connective tissue that connects bone to bone. Okay, so they attach to these different surfaces. So this is like how the bone organ looks like. And in looking at the bone tissue, we have two types of bone tissue: spongy bone tissue and compact bone tissue. And we are going to describe the tissues based on the cells, all right? So the osteoprogenitor cell that I mentioned forms, yes, osteoblast. And remember, all connective tissue have what? Cells and what? Matrix, right? And the matrix, in the matrix, what happens in the matrix is the cells produce what? Substances that ground substance. Do you remember that? Into the matrix. So, and all connective tissue have what? Fibroblasts that produces the fibers. So this is what happens. This osteoblast cell will secrete ground substance material. Ground substance material into the matrix. Okay, into the matrix. And this ground substance material is called osteoid. And it's going to be crystallized. It's going to be crystallized with calcium salts. And they call these salts, this calcium phosphate, calcium hydroxide, they call them hydroxyapatite crystals. And these will cause the bone matrix to be what? Dense, hard. Okay. And this bone matrix will include collagen fibers. Collagen fibers, which was secreted by what? The fibroblast cell. Does that make sense? Okay. So giving the bone its strength and tensility. So that the apart from calcium and phosphate, or calcium hydroxide salts and calcium phosphate salts, there are other minerals that are also somewhat present, like sodium and magnesium are also seen in the bone, but the most abundant is calcium, which is where the calcium gets stored when we have excess calcium. Now, so guess what? If I'm an osteoblast and I'm secreting all these osteoid material around me and they are getting crystallized, do you think me, the cell, the osteoblast, I can move from where I am?
No.
Absolutely. So the space where the osteoblast sits as it secretes the stuff is called lacuna. But when it's doing that, it can move. But when it gets crystallized, it can't move anymore. And this osteoblast will now no longer be called osteoblast. It's going to be called what? Osteocyte, which is the mature form of the bone. And in compact bone, so let's look at compact bone tissue. In compact bone tissue, this is what is happening. The osteoblasts arrange themselves in a circular way as they pour down their osteoid material. So this is osteoblast, osteoblast. Okay, I'm just going to draw these circles. And they are all what? Secreting what? They're all secreting what? They are osteoid ground substance material. Does that make sense? Okay, are you all getting this? So if you look at it closely, these are what? Circular, these are what? Circular. Are you all seeing that? Okay. So they secrete. Okay. Some of them are around the bone and in the middle area of the bone. They are in a straight line instead, but they all curve. Okay, secreting their substances all around. Okay. So again, where they sit when they are osteoblasts, after they become mature, they form what? Osteocytes, and they are now what? In these spaces called what? Lacuna. Capiche? Okay, they are stuck in these spaces called what? Lacuna. So one cell will want to connect to another cell, all right? One cell will want to connect to another cell because transfer of materials and stuff like that. And little canals are dug between the lacuna. Do you see what I'm doing? Little canals between the lacuna. And so these canals that is connecting one lacuna to the other lacuna on the different rows of where they have the cells, these canals are called canaliculi. Okay, so this is lacuna. Okay, lacuna. And these are what? Canaliculi. Does that make sense? Okay. So the space where the canaliculi are traversing, they call that space lamellae. And so if it's in a circular form, like in this picture that I've just drawn here, we'll call it concentric lamellae. And if it's in a straight line, then interstitial, if it's around the bone, it's called circumferential lamellae. We'll look at all those specific names later. So, of course, you are having all kinds of material over here, deposited over here. So we are looking at the compact bone tissue. So in the middle part of this material, we have blood vessels, veins and arteries, lymphatics, nerves, things in there. So this center part, where it's just surrounded with the bone material, is called the central canal or the Haversian canal. And so this circular arrangement here of the compact bone tissue, this whole circular arrangement is called the ostium. Okay, so compact bone is made up of, so when you take a bone, if this is a bone, a chicken bone, okay, and you have a transverse cut, you cut it across like this. This is how, and you are looking at it from the top part, this is how the bone is going to look like. It's going to look something like this. Does that make sense? All right. So inside here, this is where you have what? The marrow. Okay. That's where you have the bone marrow. And the bone marrow can be red bone marrow, which would be important for blood cell synthesis, or yellow bone marrow, which is just fat. It contains fat. So bone marrow can store fat as well. So this part, okay, of your bone, the kind of tissue over there is what we call the compact bone. And the compact bone is made up of what? Os joint, os joint, os joint, os joint. Does that make sense? So each circle you are seeing over here represents what? An os joint. Does that make sense? So it means within each os joint we have what? A central canal with a lot of what? Blood vessels traveling through. So do you see how bone is full of blood? It's a very alive, it's not like your hair. It's a very alive, full of vascular circulation. It has blood. It's like the compact bone has tiny, tiny blood canals having blood vessels in there. Does that make sense? So bone is really rich with, and that's the site for blood cell synthesis. So you can imagine the marrow part. Okay. So with a spongy bone, is the same thing, but just that there's no what osteoid arrangements. It just lays down. There's no central canal. There's no osteoid arrangement. Does that make sense? Okay. So we've talked about the osteoprogenitor cells forming the osteoblast, and then they form the osteocyte. There's a last cell of the bone called osteoclast, which comes from the stem cell that forms a white blood cell called macrophage. Okay, white blood cells. And the specific white blood cell is a macrophage. And what the osteoclast does is to get rid of debris or any infection that may be there, but more importantly, it's able to dissolve the matrix of the bone in order to help remodel the bone in case something happens or you exert some kind of force on it. So when you wear braces, what is happening is that the osteoclasts are what dissolving your bone and reforming bone so that your bones will align properly, and hence it will cause your teeth to align itself properly. Does that make sense? That's why you wear braces for a long time. So it's the osteoclast that is involved in what? The dissolving of the matrix and reforming. It's like remodeling. It helps with remodeling of the whole bone architecture. So basically, that's the quick overview of the osseous tissue. So what I'm going to do is to go through some parts of the slides, and then we would end there. Okay. So this is what I was telling you. We have what? 206 bones. We have axial and what? Appendicular skeleton. The appendicular skeleton has roughly 126 bones. The axial has 126. Appendicular has 80 bones. When you look at the bones, especially the areas that articulate with others, their surfaces has cartilage on it, which we call articular cartilage. I'll mention that to you later on. They have connective tissue. Example of the connective tissue they have is ligament, which connects bones to bones. So this is showing us the axial skeleton, which is the skull, the vertebral column, the sternum, the ribs, the sacrum and coccyx. And then the appendicular skeleton is the girdles, which is the pectoral girdles, the shoulder girdles, which include the clavicle and scapula, and then the upper limbs, which is the arm, forearm, and the phalange, and the hand, which contains the phalanges, the carpal bones, the ulnar and radials, the humerus bones, and then the other part of the appendicular skeleton is the hip bones, known as the pelvic bones, which is this three fused bones, 3 here, 3 here, so a total of 6, which connects by a cartilage over here called symphysis, pubic symphysis. And so the pelvic girdle, and then the lower limb forms the appendicular, are part of the appendicular skeleton, and the lower limb includes the bone in the thigh called the femur, the patella, okay, which is like a sigmoid bone, and then the bones in the leg, which includes the tibia and the fibula, and then you have the ankles and the metatarsals and phalanges. All right. So of course, the skeletal system is for support. Without the skeletal system, the whole body will be like a clump of fleshy mass, right? Wobbling around, okay, on the floor. And it's important, so it's important also as the main source of storage of calcium, and phosphates as well, but mainly calcium. In there, and the marrow, like I said, the red bone marrow is where um, the blood cells are synthesized. And of course, some of the function of the um, bone is for protecting soft tissues, like your brain is protected by the bones of the skull, your lungs and your heart by your rib cages and stuff like that. And also, it's important for leverage and movement. The muscle is attached to your bone by means of the tendon, so that it can help you move about. So I had mentioned how we can also look at bones based on the shape. Some bones are flat, like the sternum. Some bones have this sutural, uh, irregular bones that have this sutural connection, which is, they call them the Wormian bones, but they are basically flat bones. And if you look at the skull, you see them with the sutures in there. And then we have the long bones, like the bones in our upper and lower limbs, and then irregular bones like the vertebral column, the bones of the vertebral column, the pelvic bones and stuff like that. They have irregular shape. And then we have sesamoid bones. Sesamoid bones are like the patella. The patella is a sesamoid bones in the palm, the carpals, and stuff like that. And then we have short bones like our wrist bones, ankle bones, which are small, very short bones. So this is just showing us the summary of the different shapes that we have. I also told you the markings on the bones. We have different markings on the bones. Either the markings are projections or they are depressions. So depressions or they are projections or elevations or groups. So usually the projections are the parts where tendons connect muscle to the bone or ligaments connect bone to bone, while the depressions are the areas where blood vessels or nerves are traveling along the surface. So some of the features that we have, like I mentioned, canal is large passageway. A process is just a bump. Sinus is air space in the bone. Foramen is small passage. Fissure is just a cleft. So for instance, if you take the humerus, which is the bone in the arm, it has parts like the head, tubercle, sulcus, tuberosity, diaphysis, and trochlear condyle. I mentioned just some of them to you, which included tuberosity, which is small, rough projections. When the projection is small, but not rough, rounded, then they call it tubercle. But when it's rough, then they call it tuberosity. The shaft, the middle part of the bone, the long part is called what? Diaphysis. The very end is called epiphysis and stuff like that. And I also mentioned some surface markings, example the femur, So again, if it's the projection is large and rough, versus large, they call it truncata instead of tuberosity. In case it was smooth, then it would be tubercle. And then this particular bone has a neck as well, where the head of it connects to the neck. Sometimes flat surfaces where they are articulating surfaces where they connect to other bones, they call them facets. The pelvis bone, I mentioned the crest. Okay, this line, ridge, protruded ridge is called crest. So this is shown as a sinus. I mentioned sinuses. Canal or meatus is a large passageway. If the passageway is small, it's called foramen. So these are just different examples of the surface markings that we see on certain bones. So I mentioned the long bone, that it has the epiphysis, metaphysis, and diaphysis. So let's look at it. So this is the epiphysis, is the very end, and then the shaft is what they call diaphysis, which is the middle part. And between the epiphysis and the diaphysis, we have the metaphysis. And in the epiphysis, most of the bone tissue over there is spongy in nature. The other name they give to spongy bone is trabecular. They are not arranged in os joint. And then the outer part though has compact bone, but majority of the bone is spongy bone for the epiphysis. And the surface at the very end of bones, because if one bone connects to another bone, there's a cartilage there to prevent bone-to-bone rubbing, which will not be a good idea. And that cartilage on the surface is called articular cartilage. And then the metaphysis is the area that is between the shaft, which is the diaphysis, and the epiphysis. The diaphysis is where we have the marrow cavity. That's where the red marrow or the yellow marrow sits in the middle part. The marrow cavity is also known as medullary cavity. And we can either have red bone marrow or yellow bone marrow. Red bone marrow is where blood cells are formed, all the blood cells, not just red, both red and white and the platelets and all of that. While the yellow bone marrow is where some adipose tissue can be stored. So I mentioned to you that if this part is compact bone and then these parts are spongy bone, and I mentioned to you that the compact bone is made up of what? Os joints, right? And each os joint has what? Central canal with blood in there. So there's blood all over. But where did the blood originate from? The blood vessels, where did they come from? So some of them enter through the shaft, some of them enter through the metaphysis and divide into the different capillaries. So when we look at the bone vessels, bone blood vessels, or what we call the bone vasculature, we have artery and veins, usually one in each bone, going through a foramen and supplying the osteons of the compact bone with bone, because each osteon has what? The central canal, and the central canal has the bone in there. And then, and some can enter through the metaphyseal as well. So this is, you see how a bone is full of blood vessels? Okay, so this is showing us the nutrient foramen where blood vessel can go through. Okay, through here as well, like I mentioned. Okay, can branch all over, and of course we have the marrow all over in here, which will synthesize the blood cells and pour it into the blood as well. So it's showing us both arteries and veins, and some of these that will divide into capillaries and enter the different osteons. So, so again, these things in the osteon include blood vessels, lymphatic vessels, okay, nerves. All right. So if you hear from anyone who had a biopsy of bone marrow taken from them, it's so painful. You know?
But Dr. Lang,
Yes.
when you have a bone transplant, is it bone transplant?
Yeah.
They can't numb
Bone
it.
marrow
There's no way for them to numb it where you don't feel the pain.
It's the way the bone architectural system is. It's very difficult.
Okay.
I mean, they numb it the best way they can, but before they get the needle there to do the numbing, you are still feeling the pain.
You still feel it.
Does that make sense?
Mm-hmm.
Before the needle gets there to numb it for you, they could have taken whatever.
Yeah.
And of course, they numb it before they take it. Yeah.
And then when I go to like cardiac arrests and stuff, they drill holes into the bone, so like the fluids go right into the bone.
Yeah.
So it's like a faster.
Yeah. It's very, yeah.
Nice.
So this is the 4 bone cells I was telling you about. I'm going to rather start from bone number 3. Sorry, the number 3 based on this, cell number 3 based on this PowerPoint slide. So as I mentioned, we have what? Osteoprogenitor cells, which are what? The stem cells. Okay. So that they differentiate into what? Osteoblasts, right? And so they are located in the outer part of the bone called the periosteum and the inner lining of the bone called the endosteum. And they can divide. So because they can form osteoblasts, it can allow the bone to get thicker and thicker because of where they are situated on the outer and inner part of the bone. And then when they form the osteoblast is the precursor that helps with the whole process of what? Ossification. And what does the osteoblast do? To release all kinds of proteins and organic materials and produce this unmineralized matrix called what? Osteoid. That's what I was telling you about, the osteoid. And this osteoid will become calcified by calcium salts depositing into it. So changing the osteoid into what? The hard bone that we see. And then this osteoblast will now become what? Osteocyte and mature in it. So this is showing us how it looks like. This is the osteocyte, okay? This is the osteocyte right in here and located in the lacuna. So the osteocyte is located in the lacuna. And this osteocyte, this lacuna is connected to this lacuna by means of this little what? Canals called what? Canaliculi. Okay, this narrow passage is called canaliculi, so that things can be connected between the two. And so this is showing us an os joint, right? Another os joint. Do you all see that? Okay, this is the periosteum layer. So these are all the what? Osteocytes sitting in what? The lacuna. And over here, this is what? Osteocytes sitting in what? The lacuna. All right? And then the connection, these tiny things between here are what? The canaliculi. So where the canaliculi is sitting, this whole space, where the canaliculi is sitting is called what? Lamellae. So this is what? Lamellae. This is another what? Lamellae. This is what? Another lamellae. Does that make sense? All right. So they are all lamellae. And this is the spongy part of the bone. Okay, this is the spongy part of the bone in trabeculiform. And this is the compact part of the bone, as you can see from this illustration here. Okay, so, the middle part is what? The central canal or Haversian canal having the blood vessels. So we have the entrance through the surface of the bone, and then they branch into different parts. So we call them transverse T-tubes, where they can connect to other. And then when they mature, they form what? Osteocytes, the mature bone, and it cannot divide, of course. So they become part of the whole composition of the bone. But when we need, and the place they occupy, the pockets they occupy, like I said, is called lacunae. And then they connect, one lacunae connects to the other through the canaliculi, and the space between the lacunae is called lamellae. So during bone remodeling, the osteoclast will dissolve the matrix, and it's not just remodeling. In case you need calcium, the bone can be dissolved and the calcium will be released. So the last cell that is involved in remodeling of the bone matrix is the osteoclast. Okay, it's the osteoclast, and it comes from the stem cells of the white blood cells, macrophages, and it's able to dissolve the matrix, release minerals for the body to use, or to bring about remodeling of the bone. Okay.
said that also fights off infections, right?
They can get rid of the debris and stuff like that. So this strain has an osteoprogenitor cell, this strain has an osteoclast dissolved in the bone. So like I said, the bone matrix contains what? The ground substance, right? And the fibers. The fibers are what? Collagen fibers. It gives it the bone the strength and yet flexibility. And then the crystals, hydroxyapatite. There's some other salts as well, but it's mainly calcium hydroxide, calcium phosphate salt, calcium carbonate. It gives the bone the strength. So this strain has a bone that has no calcium. Do you see how soft it is? So this is what I was telling you about. The compact bone is arranged into what? Osteon. And the lamellae of the osteon, because in a circular form, they call it what? Concentric what? Lamellae. The center of each osteon is called the central canal, and it contains all these small blood vessels, like I mentioned. And then each lacunae contains the osteocytes, which is the matured cell. And then the canaliculi connects the lacuna with each other, and of course with the central canal as well. So this showing us a real picture using the light microscope to view the osteon of the bone. Okay. And then the circumference of the bone, a whole bone itself, the outer part, you don't see osteoins there, but it's still you can see the arrangement of the lacunae and then the lamellae. So those lacunae in the circumference of it, they call them circumferential lamellae. Okay. And then we have lamellae that is also between the osteoins, like over here, over here, over here. They call those lamellae interstitial lamellae. And so I told you how this osteon is connected to this osteon by what? These blood vessels, right? Through this canal. So this canal is called perforating canal. So that blood from outside can keep traveling and branching to the different osteons. So that these osteons are connected to each other through what? The perforating canals. So the perforating canals connect the osteons. And each osteon, the central canals of each osteon is connected to another osteon through the perforating canals. The spongy bones are usually in the innermost part. Okay, as you can see, they are inside towards the marrow, or when you look at the head of the bone, the long bone, is also towards the inside. The outer part is usually compact bone, and the medial part is usually spongy bone. So spongy bone, like I said, no osteon, is more in like plates, and so in the matrix have no blood vessels going through it, like the osteon has the central canal. They don't have that. So this is showing us how just the laminae, the lacunae does it. There are no perforating tubules with blood vessels, no osteon in there. And the spongy bone area, that's where we have a lot of red bone marrow, and that's where blood cells get synthesized. Usually, that's where blood cells get synthesized. So the next time we meet, we are going to talk about how bones grow thicker and longer. How does that happen? And then we are also going to look at how bones are formed from cartilage and from membrane form. We call that ossification of bone, how that occurs.
Elaine,
Yes.
you're tired today.
No, I had a little bit of an asthma attack.
You okay?
Yeah, I'm better now. I'm going home soon.
When you say soon, you're going to teach another class?
I'm good. It's not another class. I sort of teach these instructors that are teaching human biology class. So I
You have to do
I don't know. Yeah, they are actually. She called. They are at my office right now. Yeah, and I think they are waiting for me.
I feel better.
Thank you.